amongst other interests. So, as I said, he'll be taking us through the world of cancer, what we can do, hopefully, bismillah, to prevent um, cancer and the importance of early detection. So, Sir, we hope that you'll be able to talk to us about types of cancer, some of the risk factors associated with them, and things around regular screenings and various treatment options. We pray that Allah makes it easy for you, and we thank you to both our speaker and also people in the audience for joining us today. So, Bismillah ar-Rahman ar-Rahim. I'll hand over to you, Dr. Shobawale. Oh, you need to unmute yourself, sir. Yes.
Okay, am I on?
Yes, you are.
Yeah, thank you so much for having me on the floor. The organizers have came up with the idea of cancer traps, early detection, and care. If you pick anybody on the street and you ask them to say one or two things about cancer, I think they will have something to say. That goes to show that the cancer awareness is actually, high up there on the minds of most people. But for the purpose of our discussion here, we are going to do a brief overview of what cancer is generally. And then we try as much as possible to talk about few of the causes and risk factors. And from there, we can get the discussion going. Cancer, as we all know, is generally speaking, can be seen as an abnormal cell growth in the body. The human is composed of billions and billions of normal cells that all work hand in hand to make living comfortable for us as humans. However, there are some of these cells that for one reason or the other decide to be aberrant. Just like you can have a group of people and say 1,000 or 1,000,000 of them, and one or two of them will become aberrant and begin to cause problem to the others. And that's the easiest way I can explain the aberrations called cancer in the body. I've been asked to talk about the cancer traps, which cut across all the facets of cancer, because as we all know, cancer is a sneaky disease, of course, very deadly, that tends to creep in on the human body without informing, without giving us the chance or the opportunities to detect it early. As such, the stealth nature makes it a perfect villain to set traps for the humans, for the human population. And of course, there is only one way for us to escape the trap of cancer, which is by adequately getting ourselves armed with knowledge and information about it, so that it will be easy for us to combat. Having said this about the introductory aspect of cancer, we need to also understand the fact that it can affect any part of the human population. It can affect virtually anybody, irrespective of the age. So as it affects the young ones, even newborns, as it affects the young ones, the middle-aged, and the older, population, it also affects either of the sexes. So because I'm a man or a woman does not give me immunity against cancer. Because I'm educated or uneducated does not mean that I have protection against cancer. Irrespective of who we are, where we live across the globe, we are all susceptible to developing cancer at one point or the other. And the truth of the matter is that the reason why we all fear cancer is because it is intrusive. It can spread around. It can invade other normal parts of our body from outside of the originating source. So that makes it, a bit of, scary condition to deal with. Of course, the end results, if not attended to or catered to, can be very, very fatal. The fatal consequences, of course, would almost always lead to death if we allow it the free room to wreak its havoc on the human body. I haven't said this. Let me just quickly give a brief analogy. We all know what a garden looks like. I till the floor, try to plant one or two things, and after a while, I go back there and I discover that there are weeds growing there, trying to overwhelm the good plants that I have put in the soil. And that is exactly what cancer does. It spreads like weeds, trying to overwhelm the normal functionality of our body. And statistically, it can be said to be one of the leading causes of death worldwide. After, in the same category as cardiovascular diseases. Well, maybe outside of this, wars and trauma follows in quick succession. And there are different kinds of cancers. In fact, there is no part of the body that is spared of cancer. Right from the hair follicle on our hair down to the toenails on our body, there's no part of our body that cannot become cancerous. So we have quite a whole lot of cancer, but the very common ones, depending on the age and sex, can be broadly, seen as cancer of the breast, cancer of the lungs, colorectal cancer, more like cancer that affects the large intestine of the body. Of course, in men, prostate cancer is also high up there. And of course, across all populations, skin cancer. So those are the very common ones: breast, lung, colon, prostate, and skin cancers. Aside from the fact that they brought huge burden and they place, huge burden on the health of the population, it is also one of the commonest causes of death. Indeed, in 2019/2020, data has it that close to 20 million people succumbed to the ravaging effect of cancers. And a huge number of these cancers can be traceable to our lifestyles, our habits, what we eat, our lack of exercise, and some other, predisposing factors. As deadly as it is comforting to know that over 40% of cancers are actually preventable. And if detected very early enough, very, very early enough, and the right treatment modality is commenced, the journey can be a little bit tough and challenging, but the end result is always in favor of the individuals or the victims of cancer. Having this brief overview about cancer, it wouldn't be out of place for us to understand the possible causes of cancer. And therein lies the trap. Because of the way it starts in a very innocuous way. It just, kind of starts like every other medical condition that one can think of, and eventually dovetails to that terrible disease called cancer. And the causes can be looked at as an interplay between two broad categories. It is basically an interplay between the environment and the self. What I mean by this is, for the self, we are generally coded just the way we have software code that runs our Android phones, Apple phones, our laptops, and what have you. We are equally humans also have their own software too that powers the physical we see. Just the way you look at your phone and you admire the phone, without a good software, that phone is as good as useless. So the same thing too with the human body. Almost all our bodily functions that give us our specifications are coded in softwares called DNA. And it is the aberrations in certain DNAs or certain genes of our body that makes us to be susceptible to cancer first. Now, because there is a susceptibility based on genetic imprints or genetic damages, does not mean that that person is 100% candidate to develop cancer. No, it's not. The genetic aberrations would only wait for the right environmental trigger for it to begin to express itself as a disease. The easiest way I can explain this is if, for instance, we have, say, a keg of diesel or a keg of petrol in a corner around the compound. That keg can be there for as long as it takes. If someone does not go near the combustible substance with a naked light, the petrol will be there without causing any havoc. So it is the same thing with the interplay between the genetic and the environmentals. And it is part of this genetic that, in trying to screen for cancer in the early phase, that is part of what, the doctors or the laboratory scientists will do to help assist us to make an early, an early screening and diagnosis. So what are some of those risk factors or predisposing factors that can help the basic causative agents that we talked about? Like I said, the causes is basically aberrations in our, in our software coding, quote and unquote, the DNA, the genes and the DNA. So what are those factors that can come around and cause further havoc on the DNA that will now make somebody to be susceptible to developing cancer of any form in the body? Top on the list is tobacco. With tobacco, we mean either it can be smoked or it can be chewed. We understand that these days now, tobacco products can be soaked in water and people take it in as form of illicit drugs and what have you. So tobacco is high up there and it can, predispose individuals to having certain forms of cancer. Top on this list of cancer is cancer of the lungs, cancer of the mouth, the throat, intestinal cancers, and of course, bladder cancers. Following tobacco use is unhindered use of alcohol. Now, the way alcohol causes or triggers DNA damage is that alcohol contains quite a lot of carcinogens that tends to activate other carcinogens. And when we say carcinogens are substances that when they come across a healthy cell, tends to begin to cause some form of damages on those cells that can now make those cells to be aberrant, such that the transformation from a normal cell to a cancer cell can be expedited, can be very, very fast. That's one of the ways alcohol, causes cancer. Another way alcohol encourages cancer formation is that it can cause fat redistribution, obesity that tends to, predispose people to some other forms of cancers that has to do with, that has to do with weight gain and what have you. So a good example of cancer that can come from alcohol abuse is stomach, breast, throat, mouth cancers. Even cancer of the pancreas can also be caused by, consumption of alcohol. Obesity is also a predisposing factor to people developing cancer. By obesity, we mean when someone's body mass index is in the dangerous zone of what we call morbid obesity. Even when you look at the grading of BMI, I can be grade 1 obesity They can be grade 2 and they can be grade 3, and of course, morbidly obese. For those people, what it simply means is that their body weight is not being compensated for by their height. And as such, they are at risk of developing cancer. And top of the list of this cancer that could be traced to obesity is cancer of the breast, colon, esophagus, and kidney. Other things that can predispose us to, to someone having cancer is the diet. It is often said that we are what we eat. If we don't eat rightly, there are certain things that can go wrong in the body. Of course, perhaps we do not know that most times in the physiology of the human, there's what we call the gut flora. The gut flora is supposed to be some form of microorganisms that do or perform some protective functions on our body. Now, if we don't eat right and we take a whole lot of artificial foods, artificial drinks, it can upset the gut flora. And because it upsets the gut flora will not be able to mount the first form of defense against harmful substances that are coming into the body. And of course, they won't be able to express what we call immune antibodies that can help us to prevent and fight cancers at the early phase. Of course, too, there are some food that contain certain chemicals that tends to, express some dangerous effect on our DNA. And don't forget, like we said, the DNA is like the software that runs the body, just like we have software that runs the computer, the Android phones, and our gadgets. Our DNA is the software of our own body that tends to help us to function in the optimal state of, healthy living. So if that is not there, as by virtue of the fact that we take in, obnoxious food substances and toxins and chemical substances that we ought not to do, it can also, lead to cancer, can predispose us to cancer. There are certain forms of infections too that people tend to come across on a regular basis that unknowingly to us is encouraging the development of certain cancer in our system. I'll cite a very common example. There is a bacterial infection in the stomach that is, we all call H. pylori, Helicobacter pylori. The longer Helicobacter pylori stays in the body unchecked, the more damage it causes into the mucosa. By mucosa, we mean the internal lining of the stomach. The more damage it causes there, it begins to predispose the person to recurring ulcer. And by recurring ulcer, for those of us who understand Yoruba, we call it, the easiest way I can describe it is a wound that fails or refuses to heal. So if a wound refuses to heal in the body, in the presence of other insults, it can actually have a smooth transformation from being a normal wound to a cancerous wound. That is for bacterial infection. Of course, too, there are some other infections, very common infections like hepatitis, HIV, Epstein-Barr virus, hepatitis B and C. All of these viruses can encourage a normal cell in the body to begin to transform and misbehave and begin to hyperproliferate to form cancers. And how do viruses do this? We all know that, broadly speaking, we often say that there is no treatment for viruses like flu. Now, the reason why we say there are no treatments for them is because the viruses have a way of inserting themselves into the human system. Once they get into the cell of a human, it begins to toy around and reprogram the DNA of that cell to begin to hyperproliferate and begin to replicate itself in an unhindered manner. So imagine we have a population of, say, 10 good pupils, and somehow we introduce one bad pupil who is probably going to serve as a bad influence on others. If care is not taken, you don't do the right thing at the right time, that single bad influence in the midst of those 10 pupils can cause the other 10 pupils to turn out bad. So that is exactly what viruses do. Just a single virus will get into a cell, begin to toy around the natural program of the cell, the software of the cell, and begin to order that cell to begin to replicate and cause damages to the cell. And that is one of the ways that viruses, cause cancers. Again, too, viruses have the potential to bog down our immune system and get them bothered on irrelevancies, such that for every abnormal cell that are even developing naturally in our system as a natural consequences of our aging process, exposure to sunlight and what have you, the viruses will not allow our immune system to mount adequate defense against those aberrant cells at the early phase. Other predisposing factors or risk factors are hormones. Generally, our body functions both as a chemical software and an electronic software. Let us imagine it like that, and that it is the chemical software that dances to the tune of the electronic software, which is our DNA, for us to now say an individual should begin to undergo what they call a normal metabolism. A normal metabolism is just the way the body takes care of itself, generally speaking. So if for instance, I'm hungry, it is my metabolic process that will be triggered to cause certain chemical reactions that will make me feel hungry and say, oh, I need to go and eat. If it is time for me to sleep, for instance, there are certain things in the body that will kickstart that process of telling the brain, releasing certain chemicals to the brain and say, Mr. Man, it's time for you to go to bed and what have you. So that is basically like the general idea of what hormones are. So how do hormones lead to cancer? Now, we do understand that there are certain bodily functions or there are certain body parts that respond to certain hormones to fulfill their normal physiologic functions. For instance, if a woman wants to get pregnant, a woman requires an interplay between estrogen, that is like a female hormone, what makes a woman, progesterone, what makes a woman to be actively, looking forward to being, pregnant and to reproduce. So there is a complex interplay between so many of these hormones. And unfortunately, there are certain parts of our body that tends to be driven by these hormones in terms of proliferation. So for instance, if estrogen is secreted in the right quantity, it informs the bodily function of a woman in terms of the mammary functions to be optimal. Now, it is not just only the fat levels that is responding to that. There are also cells too in the human mammary gland, that is in the bosom of a woman, in the breast of a woman, that responds to those hormones. Now, in the presence of an abnormal genetic code that is primed to program the breast cells to begin to turn cancerous, of course, the estrogen will begin to feed them too. So that is one way. Another way to look at it also too is that for men, what makes a man to be a man is the male hormone that we commonly call the testosterone. That is what gives a man the husky voice, the build, the facial hair and body hair and what have you. Now, there is a tissue or there's an organ in a part of in the body of a man that responds to the stimuli of what makes a man, and that is the prostate. So if the prostate is there, for instance, and testosterone is being expressed in that is just a matter of time. That prostate will begin to dance to the tune of that testosterone in an abnormal way or in an eye service way, over response to testosterone. So that can also cause, hormones. Again, don't forget too that we produce hormones for our normal bodily function. We also take in hormones from the outside in terms of injections, drugs, patches to achieve other certain bodily functions. Top on the list of these extraneous hormones are the contraceptive pills. And you have different kinds of contraceptive pills in different combinations that contains different hormones. Now, some of these hormones can expose the user of those extraneous hormones to certain forms of cancer. Now, don't get me wrong, I'm not saying contraceptive pills is bad in and out, no. What I'm saying is that there are some contraceptive pills that when we take, tends to open us up to developing certain form of cancers. For instance, there are certain hormonal pills that when we take, protects a woman from developing cancer of the womb, uterine cancer, endometrial cancer. Again, those kind of hormones can also expose that same individual to develop breast cancer in the future. Some people are already into menopause. They are not finding life so easy. And the doctor out of the blue just said, go and start hormone replacement therapy. Where the hormone replacement therapy can actually take care of their symptoms. But is it worth it? Because on the long run, it can also expose that person to develop other forms of cancer. Now, earlier on, we talked about HIV, hepatitis, and what have you. Now, what binds HIV, aside from the fact that they are both viruses, what binds them is the fact that they can engage our immunity in some unproductive ventures for the body. So that tends to lead us into immune suppression states. In immune suppression states, where my immunity is not working at the optimum level, what normally happens is that one's ability to mount defense against those infections that can even cause cancers, those diseases that can cause cancers in the first place, are not there. And we mentioned HIV. So it's not just only HIV or diseases. Some people are placed on certain kind of medications that helps them to tolerate organ transplants. Maybe somebody has issues with a certain disease that necessitates that person to take organ from another person, maybe a kidney transplant operation. For the beneficiary of that kidney transplant to take and to utilize the transplanted kidney in the body, certain medications will have to be given to reduce its immune response so that the immunity does not kill the new kidney that has been given. Now, those drugs will not only allow that person, of course, will reduce the immunity, which will allow the person to take the kidney, but of course, it's also going to kill the person's immune response. So these are some of those causes, predisposing factors. Of course, I've not even talked about radiation from the atmosphere, from sunlight, radiation from regular and gadgets that we make use of at home, even from our phones. Our phones has been said to, of course, technology is trying to move a step ahead of that side effect of our phones and other gadgets, such that exposing ourselves to those radiations can begin to interfere with the normal programming, with the normal genetic programming of our body, and it tricks them into the negative zone, and it starts the process of cancer. And of course, we all know that the moment that process starts, the cells begins to hyperproliferate. Why? Because those body mechanisms that can tell the cells to behave itself, don't get too big, don't increase yourself in both size and number, don't move out of this environment and what have you to cause diseases elsewhere. Those mechanisms are lost. So that is for radiation. We can also come across radiation by way of our regular, hospital visits. People go to the hospitals and they say, go and be doing X-ray, go and do CT scan, all of those things, PET scans, all of those things can predispose individuals to developing cancers. Of course, too, we live in a civilized world where we rely on the basic things of life that can make us comfortable. Almost all of those things are tied down to hydrocarbons. If I have to drive my car, I have to rely on hydrocarbons. If you have to fly, we have to start talking about carbon emissions and what have you. All of these hydrocarbon also too has an impact in tweaking and distorting the biological programs as coded by our genes and DNA. And when we get ourselves exposed to some of these hydrocarbons, example is petrol and diesel. In fact, researchers have shown and confirmed that most people that works in an environment that leaves them exposed and come in contact with hydrocarbons tends to have issues around cancer of the bladder, cancer of the skin, and what have you. So hydrocarbons are also part of the predisposing and the risk factors to developing cancers. I'm sure most of us begin to wonder, why is it that we are not talking, I didn't talk about the family history and then what have you. Well, it is true. The family history can make us to be susceptible to developing cancer, but they are not primarily causal. They are not primarily causal in the sense that you can have a certain family with certain genetic codings that has been implicated in certain kind of cancer. And yet, in the first generation, second generation, third generation, you will not see the expression of those cancer diseases in their lineage. So it is not as if being relative to, being a first degree relative to someone that suffers from cancer, it does not mean that I would ordinarily also come down with cancer. No, what it simply means is that in the presence of the right environmental factors with my family history and genetic composition, I stand a higher chance of developing than the rest of the population who do not have those associations that we've talked about. So most often than not, you will hear things like causes, risk factors. The truth is, there's a thin line between them. Just like in the example of a combustible material like petrol and a naked light, a naked fire coming into contact. It is the same relationship that happens between causes and risk factor, where we can say that the cause or the conflagration from a petrol combusting is the match. Is a matchstick that has been ignited, while the causative factor is the petrol that is standing for as long as it is there, it's not going to cause any issue. Now, there are also other risk factors that we can also talk about and begin to see if we are likely going to fall into the cancer trap. Other ones I didn't mention is age. In those days, it used to be said that cancer is commoner in the advanced age group, middle age and above, and what have you. But now we see 5-year-old. In fact, we lost a patient, a 5-year-old, to cancer just about last week. So, and by the time it was even discovered, it has already metastasized. So what it means is that before, it used to be said that age can be a comforting zone for you. If you are younger, don't worry. But these days, it is not. That theory does not hold 100% anymore because of our exposure to other factors. Having said this, we may now need to start looking at the way to avoid falling into this deadly trap that has been set by this, intrusive and deadly disease, cancer. There are different ways to prevent it. And part of the prevention is also closely related to the early detection. Early detection. There are 3 basic levels of prevention. We have the primary level, where the individual has all the wherewithal to take care of the modifiable risk factors. And let me just quickly say one or two things about modifiable risk factors. Modifiable risk factors are those factors that can encourage cancer to form in an individual, but the person has a fear or total control over those factors. For instance, if someone engages in alcohol or say cigarette abuse, for instance, there was nobody that was born a smoker. We picked up those habits as we grow old for so many reasons. Now, the way I picked it up is also the way, even though it may not be easy on the long, after adequate exposure to these funny habits, to these deadly habits, the way I picked it up, I can also, take a resolute decision to drop them. So because I can impact on those risk factors, that makes them to be modifiable. We talked about diet as also being part of the risks and predisposing factors to developing cancer. Yes, it is also modifiable. I mean, why do I have to start taking genetically modified food when I can go for the naturals? Why do I have to go for canned fish that have been preserved with all forms of chemicals that are injurious to health, when I can actually go for the fresh fish in the market? Why do I have to keep consuming red meat at such, frenzy rates when I can go for fish, for instance? Why do I have to take barbecued or grilled meat when I can go for boiled meat? Why do I have to go for fried meat when I can go for, boiled meat? So those are modifiable factors. Those are factors that an individual has got perfect control over. However, for the non-modifiable risk factors, you cannot do so much. You cannot really do so much. A very good example is age. We are all going to age one way or the other. So you cannot control it. If I move on the street and I come across certain viruses, probably in the hair, it is not what I can control. It is not what I got control over. I cannot stop the sun, for instance, from shedding its UV light down onto the surface of the earth. But I can protect myself. They are wearing protective clothing. If the ozone layer is damaged, for instance, as an individual, I do not have a direct modifiable, a solution that can work immediately, that I can make a decision. Let me go and plug that, leaking ozone layer. So all of these things are not modifiable. So for us, one way to start preventing is by looking at the primary prevention rates, by primary prevention steps of avoiding all of these modifiable risks. Once I can take care of that, it then means that to a large extent, we stand a chance of not contracting cancer. And even if it's going to come at a slow pace that will give us ample time for us to be able to combat it. The second level of prevention is basically looking for ways to check if someone has a possibility of developing cancer in the nearest future. And that takes us to screening. Unfortunately, we cannot talk about all the screening methodologies that are available. We cannot talk about it because we have close to 100, if not more than 100 cancers. And each of these has other subtypes of cancer. So we have quite a whole gamut, but we cannot even screen an individual for all of this. What we'll basically do first is to say, okay, can we ask these people certain questions that can point us to signs and symptoms of cancer in the individual? So it is after that we can now say, okay, based on the sex of this individual, based on the age of this individual, based on all of these symptoms and the risk factors that this person is exposed to, these are the few cancer types that this person may contact. So as a result, we are now going to check or screen that individual for those cancer types, because trying to screen can be time consuming, can consume resources in terms of money, and because we reside in in a resource poor country, we do not have even in very rich countries, all these advanced world, they do not have the resources to throw around to begin to screen an individual for all the possible causes of cancer. So for us to screen, we need to be aware of what are those signs that will help us to now categorize certain individuals for certain screening types or certain cancer screening types. Now, the truth of the matter is that at the very early stage, at the very early phase, cancers, irrespective of where they are, they do not give cancer-specific signs and symptoms. They do not. Except in late phases or in the late stage, that's when it now begins to come into our consciousness that, oh, so it is actually cancer that has been disturbing certain individuals for a while, and we are just getting to know now. So in the very early phase, we do not have cancer-specific symptoms that will point us or that would lead us to suspect cancer. However, when certain symptoms begin to reoccur, it can trigger, a high level of, index of suspicion in that individual or the person's, medical practitioner, the person's doctor, for them to now say, okay, we are going to have you screened for so and so cancer types. So what are these very common symptoms that an individual can come up with that can make us to suspect that someone has cancer? Number one, loss of appetite. When someone begins to lose appetite at a recurring, pace, it's a cause for concern. Number two, unexplained weight loss or unintended weight loss. Now, if somebody has, issue of weight loss, rapid weight loss that you cannot explain within a short time, some authorities will say loss of more than 5% of that individual's weight. Some will say loss of 10% of that individual's weight. Whichever way it goes, 5 or 10% is a significant weight loss within a short time. Then the doctor should begin to suspect, or that person should begin to suspect the possibility of a cancer, being present in the body. If you have an unexplained fatigue for any little reason, this person feels tired. Don't forget, we said all of these symptoms are not specific for cancers. All of them. There is no symptoms that we say, because I'm tired too, this person has cancer. Because Lagbaja has not been eating for the past 1 week and has got cancer. No. And it is part of this stealth nature that makes the cancer trap a very difficult one to get out of the moment somebody is ensnared. Once you are snared in it, it becomes pretty challenging, both for the individuals, for the doctors, and for the health sector to cope with the challenges and the burden of cancer. Other symptoms that can, raise a high index of suspicion in someone is fever, when the temperature is continuously high at certain time of the day, especially at night. When someone, about to sleep at night and the fever is eating the roof, suspect in the presence of other, early warning signs that we have, enumerated. If there is a lump in the body, in fact, any lump you see in the body could be a red flag sign for the presence of cancer in the body, especially if that lump has not been there for a while, or if that lump is rapidly, progressive in size, something that is looking like the tip of my thumb, and within a short time is looking like the whole big thumb, then that person should, approach the medical practitioner for proper, screening test to be conducted. Unfortunately, a good number of these cancer-related lumps are in the initial phase and not painful. And of course, pain naturally is a protective mechanism for us. If I feel pain in certain part of my body, it gives us room to be worried and for us to seek medical attention. Unfortunately for cancer, it's not like that. And that is why, those are some of those things that contribute to cancer being a stealth and a deadly, intrusive disease on the body. These are the very, common signs or symptoms of cancer. Every other sign we see can be related or can be cancer-specific symptoms. For instance, somebody that has got, cancer of the eye can suddenly go blind. And that may not happen in someone that has got cancer of the breast. Somebody that has got cancer of the thyroid can begin to have, significant weight loss with a very big mass on his or her neck. Now, when that happens, is a cause for a medical practitioner to suspect that there could be cancer of the thyroid lying somewhere. Difficulty in swallowing, difficulty in eating, either swallowing a fluid, liquid, or even solid meals can also be a pointer to the fact that there may be something happening in the esophagus. Persistence of certain infection in the body. I mean, somebody has gone and said, I've got ulcer, gone to see the doctor, and they said, okay, let's go and do H. pylori test, and it's strongly positive. Okay, commence treatment. After 6 months, the person has, a recurring ulcer, goes back to the doctor, and the H. pylori is still positive, and it's been like that for 1, 2, 3 years. That person is a very good candidate to be screened for cancer of the stomach, or what we call gastric carcinoma. So, specific cancers would have their specific, symptoms that patients or individuals can present with. Of course, for somebody that has got cancer of the breast, which is about the most common cancers worldwide, the person can begin to have lump, which may be painless initially, change of skin color around the breast, tender. Before you know it, the lump begins to harden, and within a very short time, the person begins to bring out nipple discharge, which can be bloody, can be milky. In the presence of the lump, should be a cause for that person to be screened for cancer of the breast. So there are so many ways people can present with. If somebody can present with bloody urine, it could be a pointer to the fact that there could be bladder cancer of the bladder or cancer of the prostate if that person is a male. Someone that stopped menstruating for years, all of a sudden is now beginning to see postmenopausal bleeding from the private area. Is not normal. Cancer may not be the only reason that could make a postmenopausal woman to bleed. Of course, there are so many other ones. Cervical polyp could be there, endometrial polyp could be there. By polyp, we mean soft tissue outgrowth from those parts of the body that we have mentioned. So those can be pointer to the fact that a postmenopausal woman could be developing a stealth cancer of the cervix or a stealth cancer of the uterus. So it is the cancer specificity based on the symptoms the person has presented with that would trigger that that suspicion in the practitioner and say, oh, madam, please, why not just go for endometrial scan? Let us just be sure that your postmenopausal bleeding is not as a result of cancer. So there are so many. You cannot exhaust the symptoms of cancer. You simply cannot exhaust it. In fact, there are some cancer that would even present in an atypical manner. Imagine somebody having back pain. a man about 60, 50, 50, 60, 70 years, having recurring backache with no other sign that could be related, that you can relate to a prostate cancer. That person is also a candidate to be screened for CA prostate. We've seen quite a number of patients, in their 60s with back pain. And at the end of the day, the reason they are having the back pain is because of the cancer of the prostate. So who could have imagined that a back pain that can be caused by my awkward manner of sitting or awkward posture, the nature of my job, and lo and behold, it's being caused by cancer. So we cannot exhaust it. Maybe during the question and answer section, so many other symptoms will come up that can readily warn us. If you've got relatives, it can even be us too. It can be anyone that is experiencing some of these things. So this section is supposed to harm us with this little salient information, knowledge that can empower us to face the scourge of cancer effectively. So, like I said, screening they are just specific to the suspicion based on the symptoms. Unfortunately, by the time the symptoms are specific, it is already out of the purview of screening. It is now diagnostic modalities that will now be instituted for that person. And what are these diagnostic modalities? It is the same thing. It cuts across all different cancer forms, and they can be imaging. It can be blood workup. You can take the person's blood and look out for certain markers. By markers, we mean by markers, this is what is meant by markers. Let us imagine that we find ourselves in an empty hall and we perceive the certain aroma. Based on our experience of perception of aroma, we can readily say that what is smelling is fried fish and it's not fried egg. You would agree with me. If we are used to the aroma of beans, nobody would mistake the aroma of beans for rice, for instance. That is the easiest way I can describe what is meant by cancer markers, such that if I'm perceiving the aroma of akara, I won't be so dumb to say it is gari that is smelling. No, I won't be too naive. I won't be too confused to say that. So my ability to perceive and attach certain food types with their aroma is the marker. That aroma is the marker for that certain food types. So the same thing too can be seen or can be said to hold for cancers. So certain cancers have their aromas, and that aroma, the scientific work for them is markers. So somebody may be asked to go and do certain markers, and the presence of those markers would raise the suspicion of certain cancer cells being there. Now, but because a marker is there, does not mean that it is pathognomic. It does not mean that it is specific for a cancer. It is a bit confusing. It is counterintuitive, but let me explain this way. Imagine you walk into the kitchen and you see rice being boiled. Of course, the person will not go out and come back after 2 hours and expect to meet Eba on the fire. I hope you all understand. I walk into the kitchen, I can see them, boiling rice. I would ordinarily suspect that by the time I'm coming back, it's either I'm meeting white rice, I'm coming back to meet Chinese rice, I'm coming back to meet jollof rice, I'm coming back to meet fried rice. Now, so certain markers like that too can also, indicate the possibility of different other cancers. Just the way a boiling rice could mean that by the time I'm coming back, it is jollof rice I'll be seeing being served on the table. It could be fried rice, it could be any other thing that has to do with tribe, but definitely it cannot be Eba. So that is the way markers work generally. And of course, too, aside from the fact that the doctors can request for imaging, which can be ultrasound scan, the ultrasound scan is what, an average pregnant woman would do to see the baby inside. Those sound waves can also be deployed at different parts of the body to help us to diagnose if there's a presence of cancerous tissue in the body. Other imaging tests aside from ultrasound scan can be CT scan, can be MRI, and also can be PET scan. I mean, these are very sophisticated, technological based high power tech that has been deployed to visualize cancer within the body. But all of these things are not really, if I may say, they are not, we still cannot say they are pathognomic for cancers. We cannot, nobody can stand up and beat the chest and say, based on this imaging I'm looking at, this is what you have a brain cancer. It is true, it may be brain cancer, but what specific brain cancer is the person dealing with? Oh, this person has a cancer of the breast, but what sort of breast cancer is this person having? So that is why the most important of all of these diagnostic steps is the biopsy. By biopsy, we mean the ability to take a little part of the breast, a little part of the prostate, a little part of the muscle, a little part of the, of the diseased part of the body, and we can say, okay, to some high level of, degree, this is the type of cancer we are dealing with, and it is very easy for the oncologist to now marshal different types of drugs to combat the cancer. Now, by biopsy, the easiest way again, so that we can relate with some of these concepts we are trying to describe, the easiest way we can relate, we can understand the biopsy is, imagine I blindfold each and every one of us, and I hold a needle, a very long needle, and I use it to pierce a specific fruit, and I ask the individuals, have a taste of what this needle is tasting like. I'm very sure most of us will be able to differentiate that the needle that I'm tasting probably pierced through a sweet orange. This needle probably pierced through a grape. This needle probably pierced through a pineapple fruit. So that is the concept of biopsy. A tiny needle will pass into the body, and that needle will come out with a very tiny percentage of that diseased tissue. And of course, to the laboratory scientists, the pathologists, we look at this very tiny, speck of tissue that comes up with the needle and look at it under the microscope and tell us to a fair degree of, certainty that this person is having certain form of cancer. So that is the basic diagnostic tools that we have. Like I said, maybe during the question and answer section, we are going to talk about some of the other screening modalities that is available to us. Now, after talking about this, we should also understand the fact that a good number of all of these things we've talked about do not come cheap. And that is the saddest, trap that cancer can indulge, even for those people who can afford it. At the end of the day, it is almost always a drain pipe on the person's purse. It is almost always a thankless venture, because at the end of the day, the cancer has gotten to the advanced stage, and everything this individual has worked for in his life will be sucked, in terms of finances, will be sucked away from that person. So the way it is very expensive to treat, it is also very expensive to diagnose in some cases, and it's even also very expensive to screen in some cases. So you would agree with me that irrespective of, the availability of screening procedures, availability of diagnostic tools at our fingertips, the best way to still prevent this is still to stick to the first level of prevention, which is avoidance of all of the risk factors that we enumerated earlier on. Now, for the socio-economics of it, in most cases, that falls outside of the purview of the managing clinician, managing doctors, the oncologist, and what have you. That falls on that burden falls on relatives, the health insurance, and what have you. Now, this is where it concerns a good number of us, because whether we like it or not, we will know someone that will have cancer eventually. We will know someone that knows someone whose relatives, father, mom, sister, siblings, is battling with it. For the mere, thought of, I know Sister Lagbaja, I know Brother Lagbaja, and the brother is having this thing, it tends to form, cast a bit of heavy burden on our own psychological health too, even though I'm not the one that is suffering from it. But because I know someone that is suffering from it, it is also a burden on that individual too. So when we know that this burden will get to us either directly or indirectly, why can't we arm ourselves with basic, tips about cancer, such that it will be easy for us to educate our neighbors, to educate, friends, families, so that we can encourage them to take the right step at the very early phase, even when we even know that these symptoms are not cancer related. Because like you said, every symptoms a cancer can come up with, you have 1,001 other diseases that can present like that too. But again too, Yorubas have a saying that be mindful of the fact that that burden will fall back on you, and that even if you don't get away, we don't take anything away from this little discussion, let us go away with the fact that we can be harmed with little information to trigger the consciousness in people around us so that they can go for the screening. I mean, despite the fact that we know that the screening can be very, expensive, we also know for a fact too that a good clinician with a high level of index of suspicion can scale down your screening tests to the fairly affordable ones. And the person, that individual may be very, very lucky to pick it at little or no extra cost on us. Of course, there are treatments. Eventually, it will almost always boil down to treatments. Even when we know that this person is suffering from cancer A or cancer B or cancer C, and it is a death sentence, as relatives, as friends, as families, as colleagues, we won't close our eyes and assume that, okay, no, it's a death sentence. Let this person just die quietly. There is no death that is easy. Even the natural one is not easy. How much more the one that is coming from a deadly, medical condition like cancer. All of these things will still cost us money. It will still cost us money. So treatments the treatment can be tailored based on individual needs, based on the staging of the cancer, based on the cancer types, based on the part of the body that is affected. And it's basically almost always has to do with chemotherapy. Even from the name, it is using chemical substances to achieve therapeutic effects in people that have cancer. And they are of different, in fact, there are so many that we cannot completely talk about them. But it suffices to know that as soon as we meet our doctors, as soon as we meet the oncologist, the cancer specialist, as soon as we meet the GPs and those medical practitioners that will be instrumental to monitoring our treatment for us, let us stick to it. I belong to the school of thought that I do understand, I appreciate the fact that medical knowledge is just a little chunk. It's just a little chunk of the whole gamut of knowledge that God has endowed humanity with. I'm saying this because there are other forms of alternative care out there that people can take advantage of. You have the prophetic medicine. It's not just hospital-based care alone that we should deploy to combating cancer. We have the prophetic medicines too that, for those people who are skilled in it, they can achieve results. I'm not saying jettisoning the hospital allopathic care. I'm not saying that. What I'm saying is that the moment it is confirmed that an individual has it, throw everything at it Of course, in the midst of trying to throw everything at it, we should put safety, caution ahead first. And I know, based on my observations, based on experience, based on even medical research, that this thing helps. Things as simple as black seed oil helps to reduce certain form of cancer in the body. Things like camel milk tends to help. Even things like dates, dabenu, also tends to help, prevent certain forms of cancer of the brain. So there are so many, treatment options that we can, of course, safe treatment options that we can employ to support the hospital care that will be, that the patient will be offered. Even Ayurvedic care. Ayurvedic care, incidentally, is like the trado medical treatment of the Indians. They've done a whole lot of scientific research around them, and it works for individuals. It can also help. Things like aromatherapy. We have had people that have, terrible conditions, cancer around the nose, and the use of aroma to achieve care in them has been instituted, and they are alive today to testify to the fact that it can also help them. Even in our own local parlance, I do know that there are certain form of, little things that we don't even pay attention to, but they do help to combat. I'm not saying it will give you cure, 100% cure, but at least it helps to keep this individual in a vantage position to be able to tolerate the allopathy, care that will be offered for us in the theater, in the hospital. Surgery is almost always, well, don't let me use the word almost always. Surgery is also one of those, treatment modalities that can be offered. Of course, that will be left to the discretion of either the cancer, surgeon to take. And of course, again, too, the type that will be offered will be dependent on the types of cancer. I'm very sure I skipped out some of these things. I skipped out some vital information that I ought to have given in the course of the question and answer section. I'm sure questions will come up that would enable us to throw more light into the discourse for the day.
Sorry to interrupt you. We are actually already 10 minutes into the question and answer section, so we've got about 20 minutes left before we have. Yeah, we have one question. Oh, I was trying to find the right time. Sorry. So we have a question that says, after treating ulcer, for example, duodenum for some time, and you still have pain, at what level should you be suspicious, and what screening should you do to rule out cancer? The question is in the chat box. You can see it if you want to read it.
Okay. Well, okay. After treating ulcer duodenum for some time and you still have pains, at what level should you be suspicious, and what screening should you do to rule out cancer? Thank you so much. When I was talking, we talked about recurrence. So somebody has treated H. pylori after 3-4 months, the pain is back again, and the person goes back to the doctor, and the doctor still say, okay, go and do H. pylori test, and it's still positive. If the person can afford it, the person should not wait. Let the person just go for upper GI screening, upper GI endoscopy. A little camera will be put inside of the mouth, down, and will be tilted down into the stomach, and the camera can be rotated in a way to look at all the linings. So if there's any suspicious lining, at that point, the endoscopist would take a little bit of a chunk of the abnormal looking cells. We call it biopsy. And of course, they would take it to the laboratory, and they can make a proper diagnosis from there. But because there is a presence of H. pylori, does not mean that this candidate is an automatic cancer of the stomach candidate, gastric, CA candidate. No, it's not. It's not. Maybe I should also, say this too, that adequate treatment of H. pylori can help achieve cure, adequate treatment. And there's what they call the triple regimen. Your doctor will tell you more about this when you present to them. Thank you so much. I hope was I able to address that question?
Thank you very much, sir. If the person has a follow-up question, kindly drop it in the chat box, but we'll be moving on to the next question. Thank you, sir. So someone says that having a boil on the breast, which has a painful lump, can that be a concern for lumps that lead to breast cancer?
Yes and no. No, in the sense that if this painful lump is just coming for the very first time, there are different things that can give us a painful lump. If this person is probably breastfeeding, for instance, it could be as a result of engorgement of the breast or blockage of the ducts, the milk ducts. So these are very common causes of, cancer. These are very common causes of, painful lump in the breast. Infection of a blocked milk pipe or a blocked milk duct in the breast can also lead to, a boil-like, it looks like boil, but it's not really boil. Abscess collection. Abscess collection is just a way of saying there's been a long-standing infection around the inside of the breast, and this infection is now beginning to generate and, produce pus. And of course, wherever you have pus, you should always look for a way to track out. I mean, that is the way, the body has been designed by Allah. Once you have abscess collection, pus collection in an enclosed space, it will look for a way to track out, and that tracking may look or may appear like a boil. So these are about the 3 or 4 different causes of, a painful boil, something that looks like boil. So because I have it does not mean I've got cancer of the breast. Now, the reason why I now said yes, it could be, is because if I begin to have recurring, non-healing, boil-like mass on the breast, it could be a cause for worries. And that, at that point, that individual should go for screening. Fortunately for us, screening for cancer of the breast is very, very cheap. In fact, it doesn't cost anything other than the knowledge and the time to do it. But even if you don't have time to do it as a woman, it's something that you can make the habit of doing, even on a daily basis when you're having your bath. Once you are in the shower, I mean, it doesn't take so much. I'm sure we all know how to do it. Just quickly, these are the basic steps. The person should try as much as possible to observe the breast against a standing mirror. When you look at the breast, you look at, if you do it fairly constantly, you'll be accustomed to the sizes, because no 2 organs of the bodies are of the same size. My left eye is not the same size as my right eye, and ditto for everybody. My right hand is not the same thing, is not the same size as my left, ditto for everybody. So the same thing for me too. My right breast is not the same size as the left breast. So when I do it, that, constant, observation, I get used to the sizes. Then the next thing is for us to stand in a way like this, to firm up as if I'm angry with someone. The way women, when they want to fight, then you start akimbo and you firm up your hand against the waist. You can do that too. When you do that, that tends to firm up the muscles of the chest. So if there is any abnormal growth, abnormal tissue on that breast, firming it up this way will make it appear, if it is closer to the surface though, it will make it appear to be more pronounced, and that can raise suspicions. So the next thing for you is to raise your hand up. When you raise our hand up, what it means is that we want the breast to fall under gravity. So if there is any heavy mass there, it tends to be pronounced under gravity, it falls down. So that can now begin to raise that high index of suspicion in that individual. Of course, you have to touch it too by putting your arm over your head and you begin to palpate. Now, it is often said that you can divide the chest into 4 sections like this, right and left, upper and lower. Now, you can start with the inner upper. You can start with the outer upper. In any direction you are comfortable with is something you can do. And I'm going to try as much as possible to demonstrate that. So assuming I'm standing like this, I can actually palpate the inner one, go to the outer one, try and look at what we call the breast tail into the armpit. If there are any abnormalities, and it's something I do fairly constantly, maybe every day while I'm in the shower, just a quick one, less than 30 seconds, you are done. You can begin to appreciate abnormal masses or growth in that breast. So that is a very cheap way for that individual who have been having recurring boil, quote and unquote, recurring boil or boil-like, growth on the breast. That is a very cheap way for that person to now say, I've been doing this thing for the past 1 month. I think this thing is not normal. Let me go and complain to the doctor. So when you meet your doctor, you're being too very sure of what you feel will also reinforce that need for the doctor to be thorough when they are checking you. Of course, there are other cheaper ones like ultrasound scan of the breast, mammography. I mean, these are all screening and diagnostic tools that can be employed. Unfortunately, mammography is not getting cheaper. Again, too, for those who cannot afford it, your regular breast check, do for the one, you go to the other one like that too, would help us to quickly, it's a very cheap way of screening and, suspecting if there's anything wrong in the breast. Thank you. I hope I was able to answer and,
Thank you.
dispel the fears of the questioner.
Another question, I'm not sure it's so related to the topic, but maybe you can find a relation. Please, having a constant headache. Sorry, the question just disappeared. What is the remedy?
Now, let me quickly, share this experience. The very first, I think the first few months after leaving medical school, I met a young boy, just about 6 years old or so, always complaining of headaches. And we've gone to see the ophthalmologist, and I understand they've changed the glasses, I think twice or thrice. And I felt it's not normal for a 6-year-old to keep changing, glasses. The headache is because of the bad eyesight. After a while, the glasses correct the headache, then it comes back. Recurring headache in our environment. First, you suspect stress. Secondly, socioeconomic status. Somebody that does not have money in his pockets will naturally be worried. And worrying comes with its own form of headaches. Now, people that have constant bouts of malaria, I mean, those are the regular things that you think of first for recurring headaches. It depends, again, the type of headache this individual is having. Is it on one side of the head? Is it in the front? Or is it right in the middle of the head? All of these things can signpost different causative factors for that headaches. But whichever way is it, after ruling out all of these other causes we've mentioned, I would strongly advise this individual to go for a brain scan. If we are very sure that your problem is not money, it's not finance or socioeconomic related, it is not the stress of your husband or your wife giving you stress at home. It is not the stress of jumping from one bus to the other. It is not the stress of driving from island to mainland, spending 4, 5, 6 hours in traffic every day. It is not malaria. Please, this person should go for a brain scan. Of course, like I alluded in that 6-year-old that I was talking about before, lo and behold, I just said, go and do a CT scan. I don't think this is normal for a 6-year-old to be having, changing glasses often because of headaches. And lo and behold, it was a pituitary cancer in a 6-year-old. Fortunately, it was picked very early. The boy survived it on very cheap medications. He didn't even have to go through surgery anyway. So recurring headaches, yes. But again, too, when you understand the basic that all the symptoms of cancers have other causal factors, it is better to rule out those other ones. But if this individual has done the due diligence of having to look at these recurring headaches inside out, and this headache persists, this individual should go for a CT scan of the brain. Sorry, please, I also forget to say this. If somebody is hungry, if you are the type that don't like to eat and you are always very hungry, people who have experienced this can relate. Hunger can give recurring headaches. Inadequate intake of water, that is dehydration. If somebody does not take water, that can also mount some form of pressure on the head. So I will advise this individual, recurring headaches, after ruling out the other causes of headache, please go for CT scan of the brain.
Thank you very much, sir. That brings us to the end of all the questions that we had. Thank you very much for, imparting knowledge on us. I hope that everyone has learned a thing or two from this, I guess, session. And we pray that Allah gives us the best of health. We pray that He doesn't test us with more than we can handle. Lisa, can I ask you to give us a closing dua?
Myself?
Yes, please. Just add to what
you are taking two things away from me. Alhamdulillah, Alhamdulillah, Rabbil Alameen. We thank Allah subhanahu wa ta'ala for giving us the grace and opportunity to witness today. And we thank Him for the knowledge bestowed on each and every one of us, the understanding that He has granted us. We beseech Him to make this section the beneficial one for us. We pray Allah subhanahu wa ta'ala to multiply us in knowledge so that whatever is it that we've learned, we can use it to benefit others and it can serve as sadaqatul jariyah for each and every one of us. Al-Fatiha. Bismillah ar-Rahman ar-Rahim. Alhamdulillah Rabbil Alameen. Ar-Rahman ar-Rahim. Maliki yawmiddin. إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
Thank you very much again for honoring the invite, and we hope to see you again sometime, inshallah. And to everyone who joined us today, Jazakallah khair. Thank you so much, and we'll see you in 2 weeks' time, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh. Bye-bye.